The following short film provides listeners with further details of our annual State of Clinical Audit report. To read the report in full, please visit the CASC website. This film is based on a presentation delivered by Stephen Ashmore and myself at a Healthcare Conferences UK audit event at the start of July 2013. Both Stephen and I will narrate the film, and I'd like to hand over to Stephen at this point.
Thanks, Tracy. Let's start by looking at the aim. The aim of this presentation is to familiarise you with the findings of the December 2012 CASC online survey, and also look at trends from surveys carried out in 2010, 2011 and 2012. In terms of objectives for the presentation, we're going to tell you why we carried out the survey, how it was done, when we conducted it, who took part. The So What section will focus mainly on the results. And finally, under What Next, we'll tell you what our future plans are. So in terms of looking at why we've carried out a survey to find out views on clinical audit over the last 3 years, well, I think there are a number of reasons. But those of you who've worked in audit a number of years now will remember Sir Liam Donaldson talking about a reinvigoration back in 2007-8. And when reinvigoration was talked about, the Clinical Audit Support Centre felt very much as though we needed some sort of baseline. It's all very well talking about improving clinical audit and reinvigorating it, but we also need to measure what's happening. So that was one of the reasons why we wanted to set up survey work, to get a gauge of what people at the coalface thought. Clinical Audit Support Centre have also got quite a reputation for carrying out surveys of clinical audit professionals, and some of you may remember our 2020 conferences that took place in Leicester in 2007, 2008 and 2009. As part of those events, we conducted short surveys of attendees, asking them about topical issues of the day. So those of you that took part in those conferences may remember us handing out a questionnaire that focused on your views on local and national clinical audit, and also looking at your future hopes for clinical audit and concerns. And that was something, again, we wanted to do just to get a gauge of what the clinical audit community was thinking 5 or 6 years ago. Clinical Audit Support Centre gained perceptions from all sorts of people, and obviously we carry out lots of training across the country. We carry out training where clinical audit professionals and governance professionals come to Leicester to attend our accredited courses. And what we found was that there were lots of interesting comments being made over the last few years in relation to views on local and particularly national clinical audit. So we wanted to actually harness that information and try and conduct some sort of quantitative survey to find out whether the views that were being expressed at some of the regional, local and training events that we were attending were a good viewpoint, a good gauge of what was thought of across the clinical audit community. We were also noticing quite an interesting number of comments on national forums, such as the National Clinical Audit Forum run by HQIP. Just at a personal level, Tracy and I, back in 2009, were starting to see problems emerging, particularly our regional clinical audit group in the East Midlands called CASC was very much on life support at this stage, and the membership had dwindled from probably 25 attending quarterly meetings down to less than 10 in 2010. Tracy also was in contact with her former clinical audit team at North Staffs, and since her departure by 2010, the clinical audit team that she used to work for had halved in size. So there were some issues that we wanted to look at in a little bit more detail, and hence the survey seemed like an obvious way of finding out a little bit more in terms of what was happening out there. As clinical auditors, I think we just have a natural habit also. We want to measure things. Clinical audit is about looking at current practice and comparing it to standards. And although this is more of a survey than an audit, Clinical Audit Support Centre, as all auditors, wanted to get a view and a measurement in terms of how clinical audit was progressing
across the country. And finally, in terms of why we carried this out, Clinical Audit Support Centre were established in 2006, and I think by 2010 we felt quite comfortable that we were an established organisation. We're an independent organisation. We aren't involved in, for example, running any of the national clinical audit projects, so we don't have a conflict of interest there. We hope we're seen very much as independent. We'd established ourselves in the previous 4 years, and I'd like to think that Clinical Audit Support Centre were viewed very positively by clinical audit community, with good relations with our target audience. So it seemed as though it was a good time to conduct this work in 2010, and we seemed in quite a good opportune position to carry out this work. So a brief word on how we carried out the survey. Obviously the first survey was conducted in 2010 and it's been repeated in 2011 and 2012. When we set up the initial survey in 2010, we based this on the questions that we'd asked at the 2020 conferences in 2007 to 2009. So that was very much the starting point. We also went out to a number of our respected peers working in local clinical audit to ask them what they thought of the survey that we were going to be using, and their feedback was invaluable. And we also based the survey on our own personal beliefs, and Tracy and I very much think that if you're conducting a survey with anyone really, you should not expect people to take longer than 10 minutes to complete it. Their anonymity should absolutely be assured, and that's always been the case for the Clinical Audit Support Centre surveys. We believe that a key factor in a successful survey is to make sure that the headline results are fed back to those that take part very quickly. And since setting up this survey in 2010, results have always been available within 2 weeks. And we also make sure that there is a full report subsequently, and that the information is entirely transparent. So you will see from those of you that have looked at the reports that we've created from this work that they're very inclusive and comprehensive, and all of the information that is reported to us is made available in the wider report. In terms of how the survey was conducted, well, many of you will have taken part, and the way that we set this up was to make the survey available online. In the first 2 years, we'd like to say a big thank you to Snap Surveys, who helped set up the online survey for us, and last year Formic took over the reins. So a big thank you to both Formic and Snap Surveys for helping to make the survey live and available online. So we'd set up these surveys on the internet, and what we needed next to do was to get engagement and encourage people to take part, and we did this in a number of ways. We wanted to make as many people who may want to take part in the survey aware that it was out there, and one of the ways of doing this was to send e-postcards out to the Clinical Audit Support Centre e-news letter distribution list. So that was a good way of letting people know that the survey was being carried out. We also promoted the survey on the Clinical Audit Support Centre website. We placed notices on the National Clinical Audit Forum and also the Clinical Audit Tools website when that became available from 2012 onwards. We also informed some of the key players at a national level that this work was being undertaken. So a big thank you to organisations such as HQIP and NAG for alerting their members in the case of NAG and wider regional groups, and also to HQIP for using their website and their e-newsletter to tell the audit community that this survey was available.
Okay, I'm going to hand over to Tracy at this point, and she's going to tell you a little bit more about when the survey is carried out and who the respondents are.
Thanks, Stephen. First of all, looking at when the survey takes place. This is an annual event, and we make sure that this happens in December each year. So the focus of the presentation that you're going to hear now relates to the data collection in December 2012. In terms of who responds for us, this is really important. We always look at response rates, and we always look at who gets back to us in relation to this particular survey. So the response rates you can see on the graph on the screen at the moment. This provides information and shows that unfortunately response rates have dropped, with a high of 182 responses in 2010. In 2012 we got 137 responses. Traditionally, the majority of people who respond to the survey are clinical audit professionals. This was again the case for the 2012 survey, with 63% of respondents being clinical audit professionals. Equally, we had a high number of clinical governance professionals, 21%, and it was really good to see 10% of clinicians who have particular interests in clinical audits or clinical audit duties coming through and filling out the survey. So if we look at the graph that's on the screen, we can see that for audit and governance staff combined, it's a very high proportion of responses. So in 2010, the highest percentage was 92.3% were combined audit and governance staff. For 2012, it was 84.3%. In terms of other aspects of just looking at who responds, most people tend to come from acute care. 47% were acute care responses, and this is really consistent across the 3 years of the survey that we've run. In terms of experience in relation to working in clinical audit, this is quite varied. We get a high number of people who've worked in the profession for between 1 and 5 years, and that stood at 37% this time around, whilst we also get some people who've worked in clinical audit for 16 years and more, and that was stood at this time at 15%. Now that you've heard a little bit about the background to the survey, how it works, when we send it out to people and who responds to the survey, we thought you'd like to know a little bit more about the key findings. One of the questions that we consistently ask is, do you still intend to work in clinical audit or have responsibilities for clinical audit in 5 years' time? We appreciate this is a bit of crystal ball gazing, but I think it gives a good barometer of how people are feeling. For the 2012 survey, we can see that the result stands at 64.7% of those people who responded still very much wanted to be engaged in the profession and the discipline in 5 years' time. That is a bit of a drop-off from the high of 2010, when just over 75% of people identified they'd very much still like to work in the profession. Moving slightly away from this, we also want to think about what's more effective in relation to improving patient care. This is often a conundrum that people have as to which type of audit projects work the best. And we've asked for a very simple distinction between local and national projects. And you can see the 2012 result highlights that nearly 87% of respondents felt that local audits were more helpful in terms of improving patient care. So to illustrate the point, you can see by the graph on the screen that local audits are seen as more effective than national audits, and this view is strengthening. I'm now going to hand over to Stephen, and he's going to talk to you about the results in relation to national clinical audits.
So Tracy's provided you all with some information in relation to local clinical audit. What I'm going to spend the next few minutes on is looking at national clinical audits, and we're going to start by getting some feedback in relation to the results from 2012 in terms of what those who completed the survey thought generally about the state of national clinical audits they'd taken part in. And you can see here that 1% rated national clinical audits as excellent, which is slightly disappointing. 35% stated that national clinical audits they'd been involved in were good. The majority, 42%, rated national clinical audits as moderate, with 12% poor and 11% very poor. Now what we can do is look back over the last 3 years, and if you take a look at the graph on the screen, this is a little bit difficult to appreciate initially, but what we've got on the left hand side are the different ratings, and we've used this question in exactly the same format since 2010. Along the bottom you've got the percentage totals, so these are the results of what respondents thought of national clinical audits they had been involved in from 2010 to 2012. You will see that probably the main point to make is that over the course of the last 3 years, the majority of respondents, or the highest proportion of respondents, have always rated national clinical audits as moderate. So we've always had over 40% of respondents over the last 3 years classifying national audits they've been involved in as moderate. Quite a high proportion, you can see, in the bars above rate national clinical audits as good. But again, we're not seeing across all of the five different response options too much of a change. So that's encouraging for us, because we can see that there's quite a consistent response rate, although slightly disappointing given the amount of time and effort put into national clinical audits and the amount of focus on them over the last few years, that we're not seeing bigger improvements. Indeed, if you look at the top of the graph, there's been a reduction since 2010 in the number of respondents rating national clinical audits as excellent, and at the bottom you'll see that in 2010 very few respondents rated national clinical audits as very poor, whereas this was up to 11% in 2012. I think it's fair to say that national clinical audits have always divided opinion, and we can see this from the next two slides. So first of all, what you have on the page are a number of qualitative comments that respondents to the survey have made in relation to their views on national clinical audits, and you can see that very much the comments on this slide are incredibly positive. So a respondent said at one point, "MyNAP has been amazing." We've had a lot of very positive feedback in relation to the National Sentinel Stroke Audit. The Prescribing in Mental Health Services National Audit is often viewed as one of the best available. And you see the final comment there, Diabetes National Audit has been very effective. So there clearly are a number of respondents out there who like national clinical audits they've been involved in, and they found them to be incredibly useful and effective. Unfortunately, the results of the survey work that we've carried out show that not everyone is a big fan of national clinical audits, and this is borne out in the slide that you can see on the screen. And I'm not going to go into too much detail or really pick out any of the national clinical audits that are featured on this slide, but you can quickly see by looking at the various comments in front of you that there are some issues with national clinical audits, and certainly those who've taken time to respond to our survey have been quite keen to feedback some of the problems they've encountered. You can't see it on the slide in front of you, but just to say, over the course of 2010 to 2012, while we've been carrying out this survey work, the most popular national clinical audits have continually been the stroke audit, acute myocardial infarction, which is MyNAP, and the Prescribing in Mental Health Services audit. And on the flip side of that, the least favourable national audits have been the continence care audit and certainly most recently the heavy menstrual bleeding audit. The next slide is one that we'll put in front of you and make really no judgment of, but it's curious that if we take a look at the Falls and Bone Health National Clinical Audit, this is rated in the top 4 for the most effective national clinical audit during 2010, 2011 and 2012 when we've carried out the survey, and it is also rated in the top 3 for the least effective national clinical audit in 2010 and 2011. And Clinical Audit Support Centre don't know why that is the case, but it seems quite strange that quite a number of respondents over the last 3 years have rated one national audit consistently at the top end in terms of most effective and also at the bottom end in terms of least effective. And I guess that may come down to personal judgment. It may be impacted in terms of where you work and how relevant that national clinical audit is to you. But it seems quite strange that we've got a national clinical audit out there that some people find very useful and others find, well, they have very poor views of it. On a final note, in terms of national clinical audits, all we would want to say is we know that national clinical audits are very much under the microscope at the moment. National clinical audits have been on NAG-CAI's agenda over the course of the last few years. The same could be said for the National Audit and Governance Group, and we know that Kat Young, the new chair of NAG, is very much keen to improve national clinical audits. And I think, to be fair, HQIP have carried out some work, and I don't know how many people saw their survey in 2011, but that underlined some serious ongoing issues in relation to national clinical audits. And to be fair to HQIP, I know they've been spending a lot of time and effort in terms of trying to improve the quality of national clinical audits. So This is very much an ongoing piece of work, and in terms of how CASC can help, we will continue obviously in future surveys to monitor feedback and views on national clinical audits, and we'll report that out to the likes of NAG, CAI-NAG and HQIP to assist them, and also feed that information back to those of you that take part in the survey, kindly giving your views. So having looked at results in relation to national clinical audits in quite a lot of detail, what I'm going to do now is to focus on some of the more local matters, and this is going to be the final part of the results section. We're going to look at IT tools used to conduct audit, we're going to focus on re-audit rates, patient involvement, and also finish the results section looking at resourcing and people's views on clinical audit at the moment. So one of the questions that we asked was, how is clinical audit managed in your organisation in terms of data entry and analysis? And you can see from this slide that overwhelmingly clinical audit professionals use Excel to conduct their clinical audit entry and analysis, with 94% stating they use Excel. That's consistent over the last 3 years, and very much Excel is seen as the clinical auditor's tool of choice. You can see that Access is also pretty popular, and there are also a number of different tools such as SurveyMonkey, Snap, Formic, SPSS, etc. that are less popular but are used by the clinical audit community. One of the key changes we've seen over the last 3 years is very much the rise of SurveyMonkey. That was scoring very lowly in 2010, but we're seeing that nearly a quarter of clinical audit professionals, or those who respond to our survey, are now utilising SurveyMonkey in one format or another. It's also important to look at re-audit rates, and we know that there are huge issues in relation to re-audit, and a good clinical audit must include a re-audit as far as the Clinical Audit Support Centre are concerned. It's difficult to get an appropriate question to assess the level of re-audit rates out there in the clinical audit community, but the question we used was, to your knowledge or best approximation, what proportion of local clinical audits in your organisation result in a re-audit being carried out? And what you've got on the slide in front of you are the 2012 results. You'll see that unfortunately the highest rated response with 32% was 0 to 20% of clinical audits resulting in a re-audit, 28% rated 21 to 40%, and only 5% of respondents stated that 81% of the audits they conduct in their organisation resulted in a re-audit. If you look at the next slide, what we've done is we've combined the results for those respondents who said that their re-audit rate was between 0 and 40% for each of the last 3 years. And what's slightly concerning here is, although the results are consistent between 57 and 60% across all 3 years, we're actually starting to see a slight rise in the re-audit rate between 0 and 40%, which effectively means that, according to respondents to the survey, less clinical audits are resulting in a re-audit being carried out. The next slide isn't part of the survey, but I think it's just useful to put this up because it focuses everyone's attention, and we're all very much aware of the Francis report and what happened at mid-staffs. And so what we've put in front of you here is a quote from Dr. Suarez, who is the medical director at mid-staffs. And I think this gets across the message that we know mid-staffs were carrying out clinical audit projects, but very little attention was paid to re-audit and improving patient care. So we need to be mindful of that, and the results of the survey show us that like at mid-staffs, we need to pay much more attention in not just doing clinical audit, but making sure that the process is completed and it is effective in terms of moving organisations and healthcare forward. The next question focuses on how you rate your patient involvement in clinical audit, and believe it or not, this has been an area that has been receiving focus since the early 1990s. A lot of people think that getting patients involved in clinical audit is quite a new initiative, but I can assure you that actually clinical audit teams, clinical governance teams and healthcare providers have been encouraged to get patients actively involved in clinical audit since the early 1990s. So this is an initiative now that's over 20 years old. We can see by the results that, again, slightly disappointing considering this has been pushed out for a long time, but we can see that only 6% of respondents rated their level of patient involvement in clinical audits that they've taken part in as good. 35% rated involvement as average, but a whopping nearly 60% rated patient involvement as poor. And we appreciate that getting patients actively involved in clinical audit isn't easy, but it's something that more attention needs to be focused on, and we're going to be working with organisations such as HQIP, who are very keen to improve PPE involvement in clinical audit, to hopefully bring about some changes and improvements in this area over the course of the next few years. Our annual clinical audit survey always has a section on the important issue of resourcing, and we ask the question every year, over the last 12 months, what change has there been in the way clinical audit is resourced in your organisation? So unfortunately you can see from the graph on the screen that over double the number of respondents, just under 40%, stated that they have less resources for clinical audits than 12 months previously, whereas only 17% stated they have more. If we move on to the next slide, this gives you an opportunity to look at resourcing trends over the 3 years that we've carried out the survey. And you will see, if we look at the left-hand side, that again it's disappointing to report, but every year that we've carried out the survey, there's been less than 20% of respondents saying they have more resources for clinical audit. And I guess we have to accept that, given the current financial climate, that's probably not surprising. We can see on the right-hand side that almost 40% each year have rated the resourcing as less compared to the 12 months previously. It's encouraging to see that there is quite a share of organisations and respondents stating that there's been no change in their clinical audit resourcing, but at a time when there's more pressure on healthcare professionals to carry out clinical audit work, one would hope that more resources would be pushed towards clinical audit departments and teams at a local level, and certainly from the responses we're seeing, that doesn't appear to be the case over the course of the last 3 years. The final question we're going to look at is one we ask every year, and that's, do you feel more positive or negative about clinical audit than you did a year ago? If we start by looking at the right hand side of the graph in front of you, you can see that just under 40% responded more positively. There was around 35% stated they were neither more positive or negative, and just under 30% responded more negative to this question. So you can see there's quite a narrow bandwidth of responses across the 3 possible options. Unfortunately, if we look to the left hand side and the results for 2010, you'll see that there's been quite a change, because back in 2010, when we asked this question, 60% of respondents felt more positive about clinical audit than they had a year previously, and only just over 10% responded to this question by stating they felt more negative. So we're not entirely sure why there's been that change, but it's something to report back to those of you that took part in the survey. So that concludes the feedback in relation to the results, but just to say that we haven't focused on all the results from the report and the survey that we carried out, because we simply haven't had time, and it would make this a very long presentation. But if you want to see the full set of questions that participants are asked to take part in via the survey, then please visit the Clinical Audit Support Centre website, and you'll be able to see all of the questions we ask and the relevant results. We're going to finish this section on results by looking at a number of limitations, and I think it's important to consider what the limitations are with any survey, and it's something that CASC are always keen to do whenever we carry out survey work. So I think we have to be mindful and very honest that as Clinical Audit Support Centre is setting up this survey and people are effectively feeding back through to us, where questions link directly to the Clinical Audit Support Centre, there is likely to be some positive bias towards us. We don't know who carries out the survey on a year-by-year basis. Tracy obviously noted at the start of the presentation that there's been a drop in responses since 2010, but we don't know if it's a hardcore of individuals who complete the survey year by year, or whether we're getting a different group of professionals submitting results to us on an annual basis. Unfortunately, we don't have time to go into analysing the data in more specific detail, and that's a pity really, but the survey does take quite a lot of time in its current format. But it would be interesting to see, for example, if we broke results down by sector, are, for example, acute trusts resourcing issues the same as the issues of those working in primary care who carry out the survey? Are views in relation to national clinical audits the same by profession and by organisation, or are there differences? So, as I say, it's a shame we don't have time to focus on that in a bit more detail, and that is a limitation of the report and the survey. In terms of other limitations, I think we have to be mindful of a good question is, are we comparing apples with apples? So you'll see that I've reported some information back to re-audit results. Now, we've noticed over the last few years here at Clinical Audit Support Centre that not everyone carries out clinical audits and re-audits in the same way. So we know that some organisations use what we would call targeted re-audit, where they only conduct re-audits focusing on standards where professionals weren't meeting the standard in the first audit, so that makes those re-audits quite quick, whereas conventionally others are conducting re-audits that focus on all standards across the original first data collection stage of the audit process. So there will be differences in terms of the way some of the respondents have interpreted the questions. We also have to ask a question, is there bias towards local clinical audit? And I think both Tracy and I feel that it's inevitable to a certain degree that that is the case. Most of those who respond to the survey, we would guess, work in local clinical audit. So, for example, it's therefore not surprising that when respondents are asked whether they view local or national clinical audit as more effective, that the vast majority respond that local audit is more effective than national clinical audit. So there may be some bias towards local audit in some of the questions that we have set as part of the survey. Although we're very upfront and honest about the limitations of the survey, I think there are a number of positive trends to identify. Over 130 respondents have replied to the survey each year, and this makes it one of the most active clinical audit surveys that's carried out on an annual basis. Those who take part in the survey often complete it, and we get very few responders who miss questions out, which is encouraging. Results have been very consistent over the last 3 years, and you'll see from some of the information that we've presented in the results section of this presentation that results haven't bounced around, and that is very good news. Good to also see that national players take the information that we provide through the survey seriously, and the likes of NAGCI have discussed the results at their quarterly meetings, and we've also shared information with HQIP and the National Audit and Governance Group. Finally, there have been no negative responses from local audit staff, who are often the ones who complete the survey work for us, so we're very grateful to them. Finally, I'd like to pass back to Tracy, who's going to tell you a little bit more about our future plans and what we're going to do next in relation to the survey.
Thank you, Stephen. So really, just a couple of questions to round up. First of all, what next for us at Clinical Audit Support Centre? To make you aware, we've opened a discussion thread on the Clinical Audit Tools website. Please have a look at it, and we're very keen to get comments and feedback in relation to the results and findings. Equally, we would like to ask the audit community for whether there are specific questions that they would like to ask in the next survey. So please, again, watch out for the discussion thread on the Clinical Audit Tools website. And our intention is that we will rerun the survey in December 2013. Equally, let's have a think about what could be next for you. If you'd like to find out more and read the full report, that's available on the CASC website. And think about what the results mean. What do they mean for you and your team? How can you use them to benefit the organisation that you work within. And preferably we'd like to see these results shared far and wide. So if you've got colleagues who aren't aware of it, we'd be really grateful if you would share these on. Obviously think about adding comments to the online discussion. It's quick and easy to do, and you can be part of developing the next survey. And for us, it's very much about don't be passive. We're very grateful to those people who have responded over the last 3 years. So our final thought is a very big thank you to everybody who's completed the survey. We really couldn't do this without you. We hope the information that we in turn feed back is useful. And please do look out for the survey in December 2013. Thanks again from the Clinical Audit Support team.